Hi, my name is Kelly, and this is my physical exam. This is Karen. She is my standard patient. Prior to the exam, I cleansed my hands and I've applied a fresh set of gloves. First thing I'm going to do is the general inspection. I'll note that the patient, Karen, appears to be the age that she is. No deformities, posture is erect. And if she didn't have a mask on, I would most likely note a pleasant facial expression. She appears well nourished and hydrated. Now I'm going to go over and inspect her head and her hair, looking for any obvious deformities, lesions. I'll be looking at the texture of the hair, the distribution of the hair. Go on to palpate. Looking for any areas of tenderness, masses, and I'll palpate the hair as well. Any tenderness?
No.
No. Okay, great. All right. So moving on to the eyes. I'll inspect the eyes, looking for erythema, looking at the eyelashes and the eyebrows, hair distribution, looking for edema, any excessive tearing. If you could close your eyes so I can assess the lids. Again, looking for edema. I'm going to pull your mask down just a smidge so I can palpate your eyes. And go ahead and palpate the inner and the outer canthus and the lacrimal process. I feel no edema. Any tenderness with that?
No.
No? Okay. I'm going to look at your eyes. Go ahead and open up. All right, looking at the sclera and the conjunctiva. The sclera was nice and white, the conjunctiva was pink, and the iris is nice and blue. Take a look inside your eye. Okay, starting at a 15-degree angle. And bracing, go ahead and look out into the distance, and then coming in. All right, I'm looking at the optic disc, all four quadrants, looking at the vessels and the macula. This side as well. All right, looking at the optic disc, four quadrants, vessels, and macula. Thank you. While I'm here, I'm going to test your pupillary reaction, both direct and consensual. Please look out into the distance. Okay, the lights would be dimmed in this setting, in the clinical setting, but here they're not. Go ahead and look out into the distance. And I've noted pupillary reaction, both direct and consensual. Follow the tip of this as I go in. All right, so the pupils constrict and they accommodation is noted. Then I'm going to test for extraocular movements. Please follow the tip of this. Back to the right, and up, and down, back to the left. So no extraocular movements, nystagmus noted. Moving on to your ear. Go ahead and inspect the ear, looking at the pinna and the tragus, and behind the ear and on top of the ear. No lesions noted, no discharge, swelling, looking in the back here too, or erythema is noted. We'll take a look before I'm going to palpate the pinna and the tragus. Any tenderness?
No.
Okay. Palpate here, the pinna and the tragus. Any tenderness?
No.
Okay. So I'm going to take a look inside your ear, pulling it up and back. All right. The tympanic membrane is pearly gray. I did see the bony structures. No erythema, no impaction. and back. Okay. On the left side, the tympanic membrane is also pearly gray. Bony structures are present. No erythema, no impaction. And the cone of light is visible at 5 o'clock on the right and 7 on the left. If you could please cover your right ear. I'm going to whisper some numbers. Tell me what you hear. 366.
366.
Great. I'll try this side. Tell me what you hear.
366.
Perfect. All right. So moving on to your nose, I'm going to inspect, looking for any deviation or lesions, which I do not see. I'm going to go ahead and look inside. All right, so the mucosa is nice and pink. I see no erythema, no deviation of your septum, no nasal polyps. I'm going to go ahead and palpate your sinuses. Any tenderness there?
No.
All right, let me percuss them. Any tenderness there?
No.
Okay. All right. So go ahead and look at your mouth. First, an external inspection. Lips look good. No lesions, fissures noted. If you could please open your mouth. Looking inside, I'll be noting your dentation, counting, also looking at cavities. If you could lift up your tongue and then switches to the side and the other side. All right, oral mucosa is nice and pink. I see no lesions. Depress your tongue. Say ah. Okay. The soft palate and the hard palate both have a rise and fall. If you could please stick out your tongue and then move it side to side. Great. I'm also going to touch your face. Do you feel me touching?
Mm-hmm.
Do you feel any difference in either side of the face?
No.
Okay. I'm going to put my hands here. Go ahead and clench your jaw. And then open your mouth. Move your jaw side to side and back and forth. Perfect. Try and resist against my hand. Resist against my hand. Great. Thank you.
Mm-hmm.
I'm going to feel your lymph nodes. So during those cranial nerve tests, did not feel any did not assess any deficits. Relax your head down, relax your head down. Thank you. All right, the lymph nodes do not feel edematous to me. All right. Moving on to your neck, you can pull up your mask if you like. First thing I'll do is just inspect, looking for any obvious deformities, any lesions, any masses. It does appear to be symmetrical, and I do not see any lesions or masses. Go ahead and palpate. All right, the trachea is midline. And I do feel the isthmus of the thyroid. I'm going to give you a sip of water. You take down your mask. Take a sip and hold it in. Okay. I'm going to displace your trachea. And feel perfect. All right, so I've assessed the thyroid. Does not appear to be enlarged. Okay, so you can go ahead and put your mask up. While we're at the neck, I'm going to inspect your carotid arteries And then also I'm going to palpate them one at a time. No thrills noted. I'm going to listen to them. Starting off with the diaphragm. If you could hold your breath. And then switching to the bell. Hold your breath. Okay, you can breathe. Hold your breath. And then switching to the bell. Okay, you can breathe. All right, so no bruise were heard. Okay, all right. Moving on to the thorax. First thing I'm going to do is actually ask you to go ahead and swing your legs to the side just a little bit. Thank you. A little bit more. Perfect. All right, so I'm going to inspect the posterior thorax. First thing I'd be looking at is difference in skin tone, looking for deformities, looking for any lesions. I'd be looking at the spine and its alignment. Next, I'm going to palpate. And I'll palpate the spine as well. Any tenderness there?
No.
Okay. I'm going to percuss, avoiding the bony structures, striking quickly, the flick of the wrist, and moving across in a ladder formation. Making sure to get the entire lobe. Any tenderness there?
No.
Any tenderness there?
No.
Okay. Next thing I'm going to do is auscultate. So I'll be listening to all your lung fields, avoiding the scapula. When you feel the stethoscope on you, please just take a breath in and out. So lung sounds are clear to auscultation, no adventitious sounds. We're going to do some special tests. First thing we're going to do is assess for tactile fremitus. I'll be using the ulnar aspect of my hand, avoiding scapula. Alright, so that was not pronounced or too subdued. Therefore, no evidence of consolidation at this time. We're going to do some special tests with the stethoscope. When you feel the stethoscope on your back, please repeat 99.
99. 99. 99. 99. 99. 99. 99. 99.
Thank you.
Mm-hmm.
All right, so that was bronchophony, and it was indiscreet and muffled as I would expect. When you hear the when you feel the stethoscope on your back, please say E,
E, E, E, E, E, E, E, E.
All right, so that was egophony, and there is no E to A transition. Next one is whisper pectoriloquy. When you feel the stethoscope on your back, please whisper 1, 2, and 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Terrific. All right, so that is indiscreet as well. And next, if you could just sort of square your shoulders like that, I'm going to assess excursion. So go ahead and take a deep breath in and exhale. Great. So at the lowest portion of your lungs did have an even and symmetrical excursion. And if we were in the clinical setting, I would have assessed all of this skin to skin. All right, so then moving on to the anterior thorax, you can go ahead and spread your legs out. First thing I'll do is inspect. I'd be looking at your skin color. I would be looking for any increased work of breathing. Chest rise and fall appears to be even and unlabored, no usage of accessory muscles, and no deformities. All right, so I'm going to listen to your lung sounds using the diaphragm. Oh, before I do that, I'm going to palpate. Again, avoiding the bony structures. Any tenderness there? No? Okay. All right, and listen to your lung sounds. When you feel the stethoscope, you can just take a breath in and out. And this would be done skin to skin or on bare skin in the clinical setting. So lung sounds are clear to auscultation, and then we'll move on to the cardiac exam. So again, I've already inspected with the lungs and the thorax, so don't need to inspect, and I've already sort of palpated. I'll palpate when you're reclined. So I'm going to start listening. I'll be listening with both the diaphragm and the bell, but I'll start with the diaphragm. Look, I'm going to start at the second intercostal space, right sternal border. So this is the aortic. Left sternal border, pulmonic. Third intercostal space. Then moving down to the PMI at the fifth intercostal space, mid-sternal. Switching to the bell and working my way back up. So S1 and S2 sounds are heard, no murmurs or extra beats are auscultated. You could go ahead and lay down. First thing I'll do is, again, assess, be looking for any pulsations, and I'll be palpating your precordium for any lifts, heaves, throws. I don't feel any. Then I'll be palpating your PMI, the fifth intercostal space, mid-sternal border. Yours is about the size of a nickel. I'm going to listen to all of your heart sounds again, starting with the diaphragm. Now I'm switching back to the bell. Fifth intercostal space, mid-sternal border. Third intercostal space. Second intercostal space. Second intercostal space. All right, I'll help you sit up. the second intercostal space, right sternal border, this left sternal border, and then mid scapula at the fifth intercostal space. S1, S2 heard, no additional heart sounds or murmurs auscultated. So go on and with your pulses, we already did the carotid. Now I'm going to feel for the brachial. And the brachial, we're going to do both sides. And the radial. And the radial. I'd be grading these as I went along. Thus far, they're +2. Going for the popliteal. And the popliteal. And the dorsalis pedis. And the tibial. And the dorsalis pedis. And the tibial. Alright, so I'd be grading those pulses as I went along. They're all +2. I'm also going to occlude both your radial and your ulnar pulse. Ask you to make a fist and put your hand up. And then go ahead and open up your hand. And we'll see that it blanched. And then when I release, the colors return within 7 seconds. I will auscultate and examine the rest of the arteries during the abdominal examination. Finally, I just want, well not finally, but before we leave, I want to just look at all of your skin and assess for color and warmth. Nice and pink and warm. Skin turgor. You appear adequately hydrated. Look at your nails in between your fingers. I don't note any clubbing, any cyanosis. Capillary refill is less than 2 seconds. I'll do the same thing on your toes. No cyanosis, no discoloration. Capillary refill is less than 2 seconds. I'll also be, as a part of the peripheral vascular exam, be examining your legs, looking for discoloration, varicosities, palpating for edema. None is noted. All right, so that concludes our exam. Thank you so much for being the standardized patient.
Thank you.
Thank you.